Um, Hello, everyone. I hope I'm audible, Shravya.
Yes, ma'am, you are.
Okay. Hello, everyone. I'm Dr. Chetna. I am the manager in charge for cancer screening in Indian Cancer Society. And it's Indian Cancer Society Bangalore branch is in charge for the Karnataka State Cancer Screening. ICS is a non-governmental organization which is involved in cancer screening activities, awareness, providing treatment fund, bridge fund, counseling for these patients, and also cancer survivorship. Okay, and I have done my MD Community Medicine from Ramaya. I hope there are some students from Ramaya here today. Then I have done my MBBS from KIMS Hubli. And it's really nice to interact with undergraduate students who can make a difference in this area. Okay. And I will try to keep it very simple, interactive. And in case you have any queries, you can ask me now or later also. Shravya, will you share the screen? Go to the next slide. Okay. So I'll try to discuss it in the following contents: general camp, cancer screening camp, the COVID restrictions, and the question and answer session. Okay, I believe some of you people are very new to the concept of camp, screening camps, or camps for that matter. Shravya, can you just tell me which year of undergrads they are?
So, ma'am, they go from first year to final year.
Okay, fine. Okay, yeah, next. Some of you might have already had an experience of your general OPD, I believe. Others, because of COVID situation, you might have not experienced the hospital OPD or the hospital situation, and things are quite different now. All your sessions are online, I believe, and must be quite boring, I guess. And the interaction and the human touch that a doctor needs to know might not be there currently. But I believe once the COVID situation improves, you will get those opportunities to do. Okay. Then in general, the patients who come to your hospital are quite different from the people who come to your cancer, who come to your camps, general camps for that matter, in the villages or wherever you go. And we do see that their complaints might be very vague. They might not be very specific. And so it needs a lot of thinking before you give any medications to these people, because it's more important that you are able to identify the signs in that particular individual. And it's like a good exposure for you to learn a lot of things there. Okay, so whenever you are doing a general camp, you do take a team of doctors and a paramedical staff. It can be your nurses, the counselors, the MSWs who know that particular area. And believe me, a lot of planning is needed before you do any of these general camps. Next. So I would try to categorize this into three main areas: pre-camp activities, camp activities, and post-camp activities. Next. Okay. So first thing is you have to assess the need of that particular population which you are targeting. Okay, what is their need, what is the health need basically, and it again depends on the population, the accessibility to the hospitals, and you should decide whether it should be a general camp or it should be for any particular specific group like children or elderly or women oriented camps, or it can be specific organ related also. So first you have to identify the needs. So how would you get this data? Can anybody tell me how you will get this data? Will anybody answer me or should I continue? Okay, yeah, Jovita, it's One, you'll get hospital records, but hospital records is not representative of that particular area, right? Yes, agreed. It can be through your surveys. If you have done in that area, you can have some checklist surveys. Yes. Okay. So what is needed? Go to the next slide. Yeah. So for this, you have to interact to know what is the need. You have to interact with the local people. Okay, I'm not going to plan a survey because survey in itself is another activity apart from camp. So what I'll do is I will do a need assessment based on important people in that particular area. Like you can interact with the ASHA workers. They know a lot of stuff there. They will know what kind of diseases are very common, what is the issues there. Then you can interact with the local panchayat leader who might say that this is what is needed. People are more in need of orthopedician than something else. So based on that need, a rapid assessment you need to do, and based on that you can decide what kind of a camp you can do. Or else you can start with a general camp first, and based on the output or the patient coming to your particular camp, you can decide which specialty you need for the next time. Then do talk with the local leaders, the panchayat leader, a panchayat, and the SHGs. Can anybody tell me what is SHG? Self-help groups, yes. So self-help groups are very much present in these villages and communities, and they play a very important role in supporting each other in terms of monetary things or in terms of working environment also. So they also have a very good hold in the villages. So through these people, you can know the health needs. You can get the required permission. Please remember, whenever you go for any camp, okay, you might think that you are doing a good service to the community, but it's also important that you take the suitable required permissions from the local health authorities there. So it can be the panchayat leader, the local PHC medical officer, or the district health officer, DHO also. Then you should find out a suitable location for the camp, about which I'll discuss in detail later. Then how to advertise these things also you need to discuss with the panchayat people, because they will know better. So we won't be advertising about the camps in the social media or something, but it would be more in terms of banners or people going around announcing it in the autos like that. Then finalize the date, venue, and time of the camp. That's very important because it should not clash with any occasion in that particular village wherein the number of people coming might come down. Okay, so all these things you need to discuss with the local people who are influential. Next. Next important thing is selecting the camp location. So it is needed that you see whether this location is accessible or not. Okay, you can't do a camp in a place which is like 5 kilometers from the village because it is a huge area. You have to see whether people will come there or not. So an accessible area. Don't select any religious places, because if you select a temple, then Muslims might not come there. All those issues might come up. So don't select any religious places. Better to go for any schools, Anganwadis, or any small sub-center level setups, so that you can do it there. If nothing is available, you can even plan it in a ground with just 1 or 2 rooms available also. Okay, so basically the place should be of non-discriminatory kind. It should have basic water and toilet facilities so that everybody is at their ease. Well ventilated, more so because of the COVID situation. You should see to it that it is a well ventilated area. See that there is a provision for lights, plug points, everything, because you never know when the currents go in the villages. Okay. Then generator facility might be needed for minor dental procedures, or if you are using some scopes or as a backup. So do keep that in mind. And most importantly, if you are doing any checkups, keep in mind to have privacy for the females so that they are comfortable to get themselves checked. And because of the COVID situation, do abide by the COVID guidelines that the government releases on a day-to-day basis. Next. Okay. Again, even the camps can be sometimes done in the evening, because I believe from Ramaya, whenever we used to do camps in Kaivara, the camps used to happen in the evening so that more people could come there. So because during the daytime, they might go to the farms and all, they'll be available during the evening. So see to it that it is a convenient time for the patients to come. Okay. Next important point is advertising about the camp. Create awareness among the target group based on what is your target population or the age group. Create awareness about it. It can happen through the primary health centers there, the sub centers there, through the ASHA workers, through the link workers, through the Anganwadi teachers, Anganwadi workers, because these are the people who interact with the people on a day-to-day basis. So they will be the best option for creating awareness about your camp. Put banners and posters in suitable locations. Okay, so can anybody tell me what would be the suitable location in a village? Okay, Anganwadis, yes. Schools, temples, yes. Local markets, okay. Any banks or corporations, any milk federations, PHCs, yes. So based on where you expect the people to gather, create awareness about your camp over there. Put up posters or banners there, okay. And this has to happen at least 15 days prior so that everybody gets to know about the camp, so that people who might be interested from the nearby villages will also turn up for your camp. Okay. How else do you think we can advertise in a village? Any other ways it is done? Okay, auto rickshaw speakers then. I don't know how many people here know tamte barskondu hogtare halli kade. Okay, dramas might work for awareness, Sheila, but not necessarily for the camps. In camps, what they usually do is, okay, so you can give the information to the children to that particular area. But we also see that in villages, it's like people, I'm not getting the exact English word, tamte baskond hogodu anta heltare. There'll be a person who will make a lot of noise, sound, attract people's attention, and then announce the camp. So those things can also happen, which might sound really weird for people in the cities. Next. Okay. So permission is very important from local health authority. You might be medical students from a medical colleges, but your jurisdiction, your area of working is restricted to your hospitals only. So if you want to plan any activities outside in any particular village, you need to take permissions from the local people. So can anybody tell me who those people would be? Yeah, 61 people are there. Not any, no one is, okay, DHO, the panchayat head, okay, the panchayat leaders, the medical officer. Okay, fine. So it's from the medical and the panchayat. Panchayat is a local political group there. So you have to take permission from the DHO and the local health authority there. Okay, fine. And it is because you are answerable to that particular people, because you're doing a camp there. And also sometimes it might happen that there might be huge gathering of people. This is like pre-COVID, I'm telling, there might be huge gathering of people. So to maintain the, control the situation, they might need some extra hands, manpower, and also those things can be taken care if they are all informed earlier. Okay, next. Next important thing is for you to plan the flow of camp patients. Okay, you should have in mind as to how the patients will move from one point to another point, so that there is no confusion, there is proper clarity, and there are volunteers available to make this an easy flow. Next. Yeah. So during the camp, what you can do is you can identify, just pause there. What all things come into your mind when you are planning a camp? You people are not allowed to unmute yourself and talk, is it?
Ma'am, we should have proper information about the details of the patient, like their name, age, like they should fill some sort of a form, maybe
Yeah.
when they're coming in.
Yes. So you should have one registration form and a place where the registration can happen. Correct. Okay. Just continue the slide, Shravya. Okay. So you can have a token system based on the number of patients you are expecting, and retain the form so that you have the basic details of this particular patient with you. Okay, next. I think you can quickly go through it. Yeah. Okay. So specifically, I have put here for cancer screening. Okay, so we do a registration for the patients in general. Then the cancer screening is divided for the oral, breast, and cervical thing, and we try to maintain the flow so that people are not confused between the ways and they know where exactly they need to go. So while doing oral cancer screening, they also do general, and for females specifically, we'll be doing a gynecological examination, breast and cervical. Yeah. Okay. After this, we do dispersing of medicine. So you should identify a point where the medicines can be kept and it can be given to the patients. Okay. Then based on what kind of a referral you have for this patient. Okay, if it is just an OPD case, you saw the patient and you're sending off, then only medicines are needed. But some cases you might be interested to refer back to your hospital for further investigations or to some specialty, then you should have a follow-up card. Make it a point to have a card which is of a hard material so that the patient maintains it, not just any thin paper. Okay. Also keep a copy of that follow-up with you so that you will be able to follow up the patient properly and counsel the patient. Counseling becomes very important. You need not have a counselor for that, but any person who can convince the patient that this is needed is what I'm trying to convey here. So they should understand the importance of the investigation that happens in your hospital. And it would be nice if you could arrange a vehicle so that all the patients who need investigation can go in that particular vehicle to the hospital. Okay, next. Okay. Then post camp, you have to do the follow. So it's important for you to have this complete outline as to how your camp activities will happen. What what unit would be where would be the registration, where would be the medicines, where would be the counselor, where would be the doctor, where the checkups will happen. Everything you should have a blueprint in your planned up so that on the day of the camp there won't be any issues. Next. Okay, some of the basic units that I could think of for any general camp right now is first and foremost is COVID screening. Registration, it should be in a format. You should have a standard format. It's better to carry some printed copies so that you can quickly fill in those forms and document those things in a table for you so that it is easy for follow-up later. Make it a point to take a mobile number so that you can call the patient for follow-ups. Then it can be anthropometry like height, weight, then general checkup, referral for specialty clinics, then room for a checkup should be there, medicine dispensing, referral, and counseling. So these are some of the basic units that you should have in a camp. Next. Okay, so prior to the camp, you should already plan for the infrastructure also as to how many tables and chairs are needed. It might sound really weird, stupid for you right now, but when you plan a camp and you're expecting 100 and 200 patients, it becomes all the more important that you plan everything meticulously. So how many tables, where, how many chairs are needed for the doctors, how many chairs for the patients, how many chairs, where will you put them for the patients waiting area. All those things need to be planned properly So based on the rooms, the needs, you can plan it. Next. Okay. Whenever you are planning for any checkups, please make it a point to have some privacy. If at all these things are happening in a school and they have lots of windows, try to cover those windows with curtains or papers, and be sure that nobody can come and peep there. Okay, next. Okay, if you're planning any specific female related checkups or gynec checkups, then make it a point to have beds and cots available for the doctor to do the checkup. The camps do result in a lot of biomedical waste that are generated, and it's important and a duty for us as medical people to take it back to our hospital. So you should also have a plan ready to where you'll keep the waste bins. Put a picture of the color-coded bins, what needs to go into which bin, then how you will collect and transport it back to the hospital, and who will be in charge for this also, so that there is no issue. Otherwise, if you leave the waste there, then it might so happen that it might go into the hands of commoners who won't know what the problem or issues are with it, and it can lead to so many infections and unwanted diseases. Next. Okay. So next important thing before the camp is planning the medicine inventory. So can anybody tell me what is medicine inventory? You people are very silent, I believe, or okay, good. So it's the stock of medicines, medicine lists. Yes. So medicine inventory is basically a complete picture of the medicines, the quantity, the cost, how many you have, when is the expiry date, everything. You should have a complete idea of the medicines that you have. Okay. It's not the area for dispensing medicines. It's the basically inventory or a checklist having everything important about the medicine, so that you know what quantity you need to procure, what quantity you need to carry, those kind of stuff, so that you will be well equipped for the camp. So you have to plan a lot. Next slide. Okay, so there are various kinds of inventories available, like ABC analysis, BED analysis, that will be taught to you maybe when they take management things in community medicine. But this is what you should know. It's all about how much of medicine, how to keep the expiry dates, so that you don't give the wrong medicines anywhere. Okay, next. Okay, so the assumptions are equally important when you plan for the camp. So if you are expecting 50 females or 150 males and 50 females, then what would be the number of medicines that are required? So this can be based on past experiences, because area to area, it might vary. In some places, they are very, some patients, some village people are very, they definitely want the paracetamols, painkillers. They will ask you for more of those things. In some other places, there might be a need for antibiotics. So based on your past activity or experience, you can decide what are the medicines that you need to take. Definitely keep an extra buffer. Whatever you have calculated, keep at least a 10 to 20% extra buffer, so that in case you have more than anticipated number of patients, then you'll be able to manage it. Okay, then make a list of all these available medicines that you have, and give this list to the doctors who are coming to the camp, so that everybody has a clarity as to what medications are available in the camp. As far as possible, buy the generic medicines. It becomes cheaper also, and it's cost effective for you. Then do buy brown covers and bottles for the syrups, first aid kits in case there are any incidents there. Keep the referral cards for your particular camp if you have planned anything, the weighing machines, the measuring tapes for your anthropometry, glucometer and the BP apparatus based on the requirement, then snacks, water, batteries, or any extra materials that might be needed. Okay, please do keep a checklist of things that you have taken. See, in your enthusiasm to do the camp, you might forget that there are things which might be lifted by patients or villagers. So do keep a checklist of the stethoscopes that you have taken, the BP apparatus that you have taken, so that you will be able to check it once before you leave the camp. Next. Okay. See, any camp is a matter of team activity. It's very important that you all sit together and plan it properly. It needs a lot of coordination. You have to explain each person the activities, identify suitable individual for various activities. The one who has a very good voice, who is very authoritative, can become a volunteer and he might be able to control the crowd better. Okay, if you want, if individuals want to have a chance of knowing many things and they can be rotated over the places, then there should be one decision maker and not many, so that things move smoothly. Because things go wrong more than what you think, and then it becomes important that you have your plan B ready and you'll be able to manage the situation. Most of the time the camps are a mess until and unless you are able to take a hold of it at that particular situation. Okay, and volunteers are definitely needed to just make the flow of the patients smooth in the camp. Next. Okay, on the day of the camp, this whatever I spoke all this time was pre-camp activities. On the day of the camp, you need to reach the place on time. It shows your level of dedication towards the camp. Make it a point to be there on time. Carry adequate snacks, food and water. Cross-check the arrangements that need to happen. Speak and interact with the leaders to see if there are any last-minute changes. Build a good rapport with the people so that they start trusting you. Check if the flow of camp is correct or any changes are needed in it. Make it a point to collect the data. Capture the data so that you know what patients you saw on that day. Names and numbers for all the rooms so that you can just tell the patient, go to room number 3, go to room number 4. It makes the things easier for you also. Make tokens for registration based on the number of patients expected. Okay, and when least expected things do go wrong, that's what Murphy's Law says. So be prepared to plan and act upon it in that situation. Next. Okay. This is me taking one of the camps for the BBMP sweepers. We did a lot of cancer screening for them. Okay, then keep one person available to keep a tab on the medicines as and when they are getting over, so that you will be knowing which medicines are over, which are needed, or whether you have sufficient or not. A counselor to convince the patient for follow-ups is very important. Have a follow-up mechanism as to when these patients should come to the hospital. Then contact numbers and follow-ups. Make one person as a nodal point for this particular camp so that any person with any doubts can call that particular number and get more information. Display relevant awareness materials there. Awareness videos, if available, can also be displayed. Next. Okay. Registration needs to be properly monitored, and because of COVID, you should maintain all the norms that are advised by the government right now. Next. Okay. Okay, this is one of the photos from our camps, a general checkup which we do along with the oral cancer screening. If any of you are interested, you can also join. This is my student, Dr. Siddharth from Ramaya. Next. Okay. You should allot a place for the patients to sit or a waiting area, because depending on the type of camp, the patients might have to wait for a long time. So please make this available, put up a pandal with lots of chairs so that they are comfortable waiting there. Next. Okay, so I'll discuss about cancer screening next. So this is us doing a camp there. Okay. Then after the camp, the post-camp activities, data compilation and reporting is very important. You should do it at that particular point when you have things fresh in your memory. Take a stock of things. What are the materials that have come back? go through your checklist to see if all the items that you have taken are back or not, the equipments, the machines and all. Finalize the referral list. Plan with the various departments as to when the patients can be brought to the hospital so that it becomes easy. As far as possible, have the referral on a same day so that it becomes easy for you to pick up and drop them. And also having other patients with them will give them more comfort. So the patients will feel comfortable if they have others with them to support them. Next. Okay, next I'll discuss about the cancer screening. Currently, because of the COVID situation, cancer screening has been stopped because it's considered as a non-essential activity. And when we are doing screening, it's basically the healthy individuals that we are targeting. So it is a non-essential activity, and so it has been stopped. So given current COVID situation, you will not be able to do it the way we used to do earlier. I'll tell you how you can change it a little for the convenience. Okay, first and foremost important is creating awareness among the public who come for the cancer screening camp, because as I said earlier, screening activity happens in a healthy individual. Okay, if at all the patient has any mass or a huge lump, he would have already gone to the doctor if it is in stage 3 or 4. Earlier stages, they might not notice it. So you have to convince the patients about the importance of the cancer screening. Next. Okay, so various units need to be planned the way it has been put up here. Okay, so if you can see, there are some 3 units here. One is a registration, one is a counseling thing. So keep it organized and in a flow manner. Okay, there should be a flow there. Okay, then cancer screening, as I said earlier, it's non-essential, cannot be done. Can be done as a part of other checkups. Okay, let me explain that further. Next. Okay, so you should screen for cancer if the patient has any of the warning signs. So let me quickly go through the warning signs. Next. Okay, if the patient complains of any change in bowel or bladder habits, which is there for quite some time, at least 10 to 15 days, then you can think it as suggestive of cancer. Okay, definitely these signs and symptoms can be present even in other diseases also. Okay, so it needs to be evaluated by a doctor. Any wound on the body which has not healed for a long time needs to be checked for malignancy. Even during diabetes, the patients might complain of these things. So take the history properly so that you know. Next. Unusual bleeding or discharge. If the patient is complaining, then it is all the more important that you screen the patient for cancer based on the organ or the area or orifices from which the bleeding or discharge is happening. Okay, then any thickening or lump anywhere in the body, if you are seeing that it is growing in a size, if it has not been evaluated by a doctor earlier, needs to be evaluated for malignancy. Next. Indigestion or difficulty in swallowing, initially for the solids, then later on for the liquids, is again suggestive of malignancies related to the esophagus. So it again can be evaluated. Any change complained in the wart or a mole needs to be checked for malignancy. Okay, in certain patients, when they have cancers related to the voice box, they do complain of nagging cough or hoarseness. So if any of these warning signs are there in your general camps, then these patients can be referred for cancer screening. Okay, next. Along with this, patient complaining of weight loss, that is more than 10% weight loss in at least in around 6 months, or having a history of tobacco, alcohol, needs to be evaluated for cancer. Okay, tobacco is a huge risk factor for malignancies. Almost 40% of the cancers are related to tobacco. Next. Okay, so the most common cancers that we know in India are breast cancer, lip and oral cavity cancer, that's the head and neck, cervical cancer, stomach cancer, and lung cancer. Okay, next. In these cancers, the most suitable ones for screening are head and neck cancer, that's the oral throat and the neck cancers, breast cancer, and cervical cancer. So whenever ICS, Indian Cancer Society, does cancer screening, it is for these 3 cancers. Though lung cancer is very common, we don't have a cancer screening tool for it. So these are the 3 cancers for which we screen. Next. Okay. Lip oral cavity cancer is the most common cancer in India among the males. Next. So let me quickly go through the risk factors. As I said earlier, if anybody has these risk factors, it is important that you evaluate him for the head and neck cancer. So the risk factors for oral cancer are alcohol, tobacco, both smokeless and smoke forms, then ultraviolet rays exposure. If at all a person is a farmer and he complains of any lesion on his lips, then you should think of oral cancer. Okay. Occupational exposure, certain factory exposures to certain chemicals can be a reason wherein occupational history becomes important. Please remember, alcohol is, there is no safe limit for alcohol, and any amount is a risk factor for cancer. Next. So the symptoms of oral cancer that you can ask are burning sensation in the oral cavity. The patient will specifically come and tell you that he has this burning sensation. It's more so when he is having a spicy food. Difficulty in swallowing, white or red patches in the oral cavity, the picture of which I'll show it later. Any non-healing ulcers which are there for more than 10 days. Sudden weight loss. Any swelling or lump which is seen in the head and neck region. It can be either the lump or it can be the lymph nodes enlargement also. Hoarseness in the voice or difficulty in opening the mouth. Difficulty in opening of mouth is seen with individuals who take tobacco for a long time, wherein we see that the opening of mouth is restricted, and usually 4 to 5 fingers is what we'll be able to put into our mouth. But in these patients who have been having tobacco for a long time, just 2 fingers can be put. Okay. Next. So for oral cancer screening, based on the availability, you can either use a torch or a scope. It can be a portable laryngoscope also. You can use a tongue depressor to see the various areas for any lesions. It's important that you follow a clockwise method so that you don't miss any region. So from the beginning only, make it a point to start to be methodical so that you don't miss any areas. Okay, next. Okay, as I said earlier, these are the oral pre-malignant lesions, the white or the red patches that we look for in patients who have the habit of tobacco. So you can see these white patches and the red patches there. Okay, these are pre-malignant lesions. White ones are the leukoplakia, the red ones are the erythroplakia. These are the pre-malignant lesions, and whenever we do cancer screening, we try to identify the individuals in this particular stage. So if at all we are able to identify the individuals in this particular stage, we can give him medications, treatment, counseling, and this lesions might regress and the chances of developing malignancy is taken care of. So it's important to identify them at this stage. Next. Okay. So what you can advise, since we don't have permissions for doing cancer screening, what you can do is, if you know anybody with the risk factors that I mentioned earlier, you can ask them to start the habit of oral self-examination. So this oral self-examination is a time-tested method which will help us in identifying these lesions earlier. So as you can see in the picture, it should be clockwise. You start from the upper, just below your upper lip, the sides of your mouth, below the tongue, the sides of the tongue, and in the palate. So if you are following it up properly, then you will be able to identify these lesions. So you should see for any white or red patches there. In case you see any of those things, then you should be going to the doctor so that they can evaluate it better. It can be both a dentist or the ENT surgeon also, who will be able to identify this. Okay, I'll take this question later. Okay, there's a question here. How would you differentiate the inflammatory lesions from cancer? See, inflammatory lesions will regress with treatment, but cancer lesions won't regress. Okay, it will go on progressing, and specifically the patient will give you a history of tobacco use. Okay, most important thing, history is tobacco use. Okay, so this is something that oral self-examination is something that you can teach your watchman, your maid, so that they can learn this simple technique and identify the lesions at the earliest. Anybody with such lesion, you can refer to our helpline number, which I'll be sharing in the end. We will be providing them a consultation with the oncologist so that it can be identified and taken care. Next. Okay. The next important cancer I would like to discuss is breast cancer. 1 in 28 females can get breast cancer in India, and it's one of the leading cancer in India. And Bangalore ranks number 3 in breast cancer. Yes, what you heard is correct. Bangalore ranks number 3 in breast cancer. And what we see in India is the stage at which breast cancer is detected is very late, and because of which the survival chances becomes less. Next. Okay, the symptoms of breast cancer you should be knowing so that you can ask the females about it. Any lump in the breast or in the underarm region or the axillary region. Next. Any breast irritation or dimpling or puckering, that is the pudgy orange appearance, can also be there. That is, the skin looks like that of a orange. Okay, next. Redness or flaking of skin on the nipple or elsewhere on the breast tissue. If you see any peeling or something, then it needs to be evaluated by the doctor. Next. Pulling in of nipple or pain in the nipple area is important. Please remember, some of the females might have a retracted nipple from the initial stages only, from her younger age. If that is there, then it is normal. But if there is a retraction of nipple which is recent origin, then it needs to be evaluated, because it goes more in favor of malignancy. Next. Any discharge from the nipple, pain in any area of the breast, change in the size or shape of the breast, thickening or swelling of part of the breast. These are all the various signs of breast cancer which you need to ask the patient for, and you should evaluate. Okay, next. Okay, so just go back. So clinical breast examination is the screening tool that we use for examining the breast in the camps. Most important thing here is the privacy for the patient so that she's comfortable there. Next. Okay, in the inspection part, ask the patient to undress up to the waist, ask the patient to feel, make the patient feel comfortable, then check or see the breast for size, symmetry, the shape, any changes in skin color, any visible lumps, any skin tethering. Nipple, look out for any everted or flat or inverted nipple, any cracking or any bleeding or discharge. So this is what you'll observe in the inspection of the breast in clinical breast examination. Then next. Ask the patient to raise the arms above her head and see if the breast movement is there or not. Both the breast should move upwards towards the same level, and even the nipple should be at the same height, so that it means that they are normal. In case there is any lump there, then it will pull the breast down, so the breast will not move up on moving the hands. And then ask the patient to place hands on the hip and see if there are any changes or visible lumps there. Next. Then follow the palpation method, wherein you will use the just go back to the previous slide. Okay, so in inspection, after you have seen the patient properly, then ask the patient to raise her arms and see if the breast moves upwards and if the height of the nipple is on the same level or not. I'll discuss about fibroadenoma in the later stage. Okay, then ask the patient to place hands on the hip and just press it gently so that any lumps might become visible when she does this maneuver. Okay, Next. Next is the palpation. So using the 3 middle fingers, you are supposed to palpate using a gentle rotation movement. Okay, a gentle rotation movement is used. You can, the important thing is you have to be systematic, methodical. Follow from the collarbone beneath till beneath the breast tissue. Check the axilla also. Press the nipple gently to see if there is any discharge. And it's always better to do the breast examination after the periods, because before the periods, the patient might be having kind of lumps because of the PMS symptoms. Next. Okay, so this clinical breast examination needs to be repeated in a standing and a lying down position so that you will be able to cover all the breast areas, and any lump which might not have been visible on standing might become palpable on lying down posture. Okay, and once you finish this, make it a point to report properly. Identify and report the findings properly like a clock face. So starting like a face of the clock, 12, 3, 6, 9 other things that we use to identify the lumps. Okay, and mention the measurement of the lump and record any other abnormality that you might have observed. Next. Next. Okay, since as I said earlier, we can't do breast cancer screening, what we can instead do is teach the patients or the females self-breast examination. It's a very easy method which has to be done every month. Women above the age of 20 years need to do it after 1 week of their periods, and postmenopausal women should keep a reminder every month on a particular day and do it. Next. Okay. So in the first step, the patient stands in front of the mirror, compares both the breasts for any difference in size, shape, or color. Okay, next. The second step, the patient has to raise 1 in 300 men can get breast cancer in India. So yes, even men are prone for breast cancer, but we don't advise them self-breast examination because of the rudimentary breast tissue in the male, it becomes quite obvious even if they have a small lump there. Okay. So step 2 involves raising both the hands and observing again for any difference and the height of the nipple. Next. Step 3, raise one arm using the fingers of the same 3 fingers the way we do in clinical breast examination. Using the 3 fingers, you have to move, the patient has to move it on her breast to check the breast tissue to feel for any unusual lump. Initially, you can advise the patient to compare the breast texture on either side so that she knows where the mammary glands are there, so that she'll be able to identify the lumps and the normal structures properly. Okay. At the end, squeeze the nipple gently to check if any discharge happens, and the same steps are repeated for the other breast. Next. Similar steps are repeated while lying down. As I said earlier, the steps are repeated in standing and lying down posture so that any small lump which might not have been prominent during standing will become prominent while the patient lies down. Repeat the same steps on the other breast. Next. So this is the simple self-breast examination technique that I believe you as medical students can explain it to your near relatives, friends, family, extended family and all, so that they can understand the importance. I have seen many times when I have given an awareness session, the next day I have got patients coming from that particular awareness session complaining of breast lumps. So please do explain this technique, and I'll also be sharing the poster for self-breast examination so that you can explain it to you can distribute it to the people. Okay. The other important thing you should know is based on the age, kind of cancer screening method changes. So when the patient is between 20s and 30s, clinical breast examination is advised. For women above the age of 40 years, mammogram is advised. So for your mothers, please do advise mammogram, and based on the report, the doctor will advise you the periodicity of it. Next. Okay. Cervical cancer is another important problem that we see in India. Rural women tend to develop it more, and length of survival depends on the stage at which it is detected. It is really sad to know that many cervical cancer cases are detected at stage 3 and stage 4. And in our camps, we do detect pre-malignant cervical cancer cases, which then go for colposcopy and suitable procedures so that they can survive with complete normal life. Next. Okay, it's the second most common cancer in women. 35 to 64 years is the age group in which we usually see. Next. Okay, symptoms of cervical cancer are, initially it doesn't show any symptoms. Later on, you can see that vaginal bleeding can happen between the periods, after sex, and also postmenopausal. So if any of these vaginal bleeding is there, then it needs to be evaluated for malignancy. Any unusual vaginal discharge, which is not going even after treatment, also needs to be evaluated. Next. Okay. So for cervical cancer screening, what we advise is Pap smear once in 3 years after 21 age till the age of 65. And any sexually active female can go for Pap smear examination. Okay. And we do have the option of HPV vaccination, Gardasil and Cervarix, which can be taken before you're sexually active. And if you complete the course, then it does give you protection against some strains of HPV. But in spite of vaccination, you have to still continue with the Pap smear. Next. Please do advise Pap smear for your mothers. Okay. Then for cervical cancer screening, what we do is 2 methods are available, VIA and Pap smear. So VIA is a very simple method. And next slide. So visual inspection with acetic acid is the method there. And in case a person has a positive lesion, okay, suggestive of malignancy, it will show as white lesion like this in the picture. It's because of the acetic acid which acts on the protein in the cells over there. Okay, and these positive cases can then be taken for colposcopy and further treatment. Okay, this is one method. The other one is, next slide, Pap smear. Pap smear is a little causes a little discomfort, agreed, because they put a speculum, observe the cervix, and take a sample from the cervix so that they are able to identify any malignant cells there. Next slide. This sample is then put up on a slide. Then it is stained and then sent to the lab for the pathological investigations. Next slide. Okay, this is one of the samples. Okay, can you please go to the previous slide? Is this the slide that you wanted? Okay, please go to the previous one. Okay, fine. So what they do in Pap smear is they'll put the patient in the lithotomy position, then insert the speculum inside, observe the cervix, and then using the couscous brush, they put it inside the cervix and turn it once 360 degrees so that you get the exfoliated cells from there. And then these cells are put up on a slide, fixed, and then sent to the lab for reporting. Okay, I hope that makes things clear. Next slide. Next. Okay, so this is one of the sample reports that we usually get from the lab. So this comes after the camps, and that is why it's important for us to have a proper follow-up mechanism so that anybody who comes positive in the Pap smear can be followed up later. So Pap smear explains whether any malignant cells are there or not in that particular sample. Okay, if there are any pre-malignant lesions like cervical intraepithelial neoplasia, SIN1, SIN2, then they can be treated at this stage. Okay, and that means that you are preventing the occurrence of cervical cancer in that patient using this technique. Next. Okay, that completes the cancer screening. because of the COVID restrictions, plan your camps based on the government guidelines, which keeps changing on a day-to-day basis. Be practical. You should be enthusiastic, optimistic, but then you should also be practical. Avoid overcrowding to prevent the occurrence of an outbreak of COVID there. Next. Okay. So as I said earlier, if at all you find anyone with any suspicious lesions from the after they do the oral self-examination or breast self-examination, you can refer them to this particular helpline number 080-4718-2786. This is a free cancer helpline number wherein we are providing them counseling and consultations with the oncologist through the telemedicine facility, and it's absolutely free for the patients throughout Karnataka. Please do spread this information to others. If you could share this on your WhatsApp status, that would be really useful for us so that people come to know about it. Next. Next. Okay. You can ask me questions now. If any patients are there from other states also, please do put in touch. We have treated patients from Orissa, Maharashtra also.
All right. So thank you so much, ma'am, for that very informative session. I think now we can go on to the question and answers if the college heads or anyone has questions to ask. So we have enabled the unmute option. If anyone wants to unmute themselves and interact with ma'am, you can do so, or you can drop your questions in the chat box. They will be addressed by ma'am. And ma'am, we also had a pre-event form, which was filled by a few who had doubts. So I'll just read out the questions which were asked by them. So
Okay.
one of the questions.
Sorry, 1 second. Anybody from Ramaya? No? Okay. Anybody from Hubli, kids? Okay, fine. Yeah, please continue.
So if you are from Hubli or KIMS, you can raise your hands and you can interact with ma'am too. So ma'am, the first question is, in this world which is so aware of money-mindedness, people are really worried about manipulations of doctors. How to obtain the trust of patients into getting themselves screened for cancer?
Okay, so as I said, it becomes important that we create a cancer awareness there. And whenever we do these camps, we do tie up with the local NGOs or local partners there who have already got a good hold on the public there. And whenever I do camps, I make it a point to interact with the patients personally so that they can feel connected to us. And it's important that you build that trust among the patients so that they will come back to you for the follow-up. And that's again an important role which the MSWs and the counselors play.
Right. All right. Thank you, ma'am. So I think the questionnaire also said, how can we screen in specific for occupational related cancers? So would you like to elaborate on that?
As such, for occupational cancer screening, we are not doing anything in that particular area because occupation to occupation, it varies. But I would definitely say that occupational setting is a very good setting for doing cancer screening. We have done many cancer camps in garments factory and all, and we have got very good results there where we were able to save many lives.
Yes, that's true. So one of the questions in the chat box is, which department should be involved for organizing a cancer screening camp?
Okay, as I said earlier, I am a person from community medicine background and I do practice preventive oncology because I do the cancer screening there. Okay, if you ask me, I would prefer to have a dentist or an ENT person for the oral cancer screening. For the breast and cervical, anybody who has been trained in this particular thing can do. Otherwise, you can go for the gynecologist or the radiotherapy oncologist also. It's not necessary that you have to have the oncologist only for the cancer screening. You can start with the other departments also, wherein they'll be able to identify the suspects and then refer them to the specialties.
Right. All right. So, ma'am, the thing about language barriers, so how to break the language barrier while organizing a camp?
Okay, there are many times when we have to give talks in Kannada followed by Tamil also. If you're honest, you will be able to interact with them quite well, and try to find a link or a connection with them. Even if you speak one or two Tamil words in the middle, they'll feel really happy, and they will feel that yes, they can link to this doctor. And you have to tell them that you are not stopping at the screening. Okay, after that, whatever follows, the follow up, the investigations are also taken care by you at a subsidized price if it's a hospital. From ICS, we do it absolutely free. So we they get that faith because they would have heard those words about us, and also the way we interacted.
True, ma'am. So the last question in the chat box is, they say as undergraduates, we can't do a lot of the clinical parts, which was discussed. So can we ask the professors or interns to help us, especially in that aspect?
Yes, if you are interested in learning more of these cancer screening activities, you can do drop in to ICS Bangalore whenever we start cancer screening. Right now, we are not doing. And many of the interns from Ramaya were had learned a lot of cancer screening when they got involved with me in our camps. So even if you want to observe, you're welcome as a medical student whenever that happens.
Right. All right, ma'am. So there's another question. Is there any way for us students to get in touch with the Indian Medical Society for organizing these screening camps?
Okay, it's Indian Cancer Society. It's not Indian Medical Society. Okay, you can get in touch with us. But since COVID is there, we are not allowed to do cancer screening. But at a later date, if you want to do any cancer screening in your outreach centers, in your rural field practice area, urban field practice area, please do get in touch with us through the social media. I'll share my email ID also. You can drop in a mail to us and we will support you for that. And the patients will be referred to your own hospitals so that you also get an opportunity to look at the cases as to how they follow up.
Yes, that's very true, ma'am. So there's another question. How can we scan for corona on spot in the scenario of a pandemic during the camps or in later stages after the pandemic?
See, right now what you can do is thermal scanning, but you also know that asymptomatic patients do come in. So what, apart from thermal scanning, you can do is rapid antigen test.
All right. Yes, ma'am. So there are no more questions in the chat box. So I'll just take this time to introduce Dr. Avi Singh. He's the Vice Overall Chairperson of AMSA India, and he's here with us today. So Dr. Avi, could you please unmute yourself? Yeah.
Hi, Shravya, am I audible?
Yeah, you are, Avi.
Perfect. Thank you. I'm so sorry. I just got free from my hospital duties currently. So I managed to squeeze in some time because I was looking forward to this amazing session. So not wasting any more time, first of all, I would really want to thank Dr. Chetna for this amazing, innovative, intricate, and comprehensive session. I mean, uh, the topic that has been taken up, I was so intrigued the day that it came to my ears, and I'm so happy that a lot many people can dive into this subject, which I'm pretty sure a lot of people didn't even know that they can know more about. So that was, I think, a very amazing privilege for most college heads. I myself started this journey being a college head. So I realized that this is a great opportunity for as many college heads that have been here. Um, First of all, thank you, Asmita. Thank you, Shravya, for taking this up, for getting Dr. Chetna on this platform for all of us, which is such a huge thing. You guys have been putting in so much effort, and I'm sorry for any inconvenience that might have been from our end, but I'm sure it's going great. Moving towards the topic, there are a few things that come to my mind when I think about oncology and cancer. So I would say like 10 years back from now, and even now in a lot of places, cancer is one word that gets to the head of so many people more than the fact a lot of people don't even understand what basically the pathology is, what organ it is affecting, what is the prognosis, how is the diagnosis done. It's different for every cancer. But when you say cancer, and what hits the mind of a person is something that you can only imagine once you are in their shoes. And in the previous 10 to 15 years, I would say, uh, oncology and preventive oncology especially has taken such huge leaps that the population still has to get much aware about what is the power of preventive oncology. One example that really hits me very hard is the scenario how things were in the United States or in the developed parts of the country. Cervical cancer was the definite leading cause of cancer in most parts of the world, and it was the power of preventive oncology, basically cervical screening, the pap smear, that as of now cervical cancer rates to a very low level, especially in the developed countries now. It's being led by breast cancer and lung cancer other. But specifically, the power of screening was so immense that the cancer that led to the top somehow is relatively insignificant in the developed countries now. And that is something that in India, because we definitely have this special situation of exploding population, that it becomes a challenge to to take up any issue here. But I think along with the challenge comes this huge potential of doing good to others. So that way, I think India has a huge scope, and Dr. Chetna and many more amazing people who've been working in this department, because we hear everywhere that oncology is now rising like a super speciality field for a lot of people. I've personally come across a lot of students who would rather initially say, like 5 years from now, I would say I wanted to be a cardiologist, right? I hear people saying I want to be an oncosurgeon, I want to be an oncologist, right? So that's a beautiful thing that I hear. And another thing that I realize is that in all our books, like if I would say, if ma'am would agree, I think 10 years from now, the pathology books that we used to read had this histopathological basis to it. The pathophysiology, most of them were like, it is uncertain as of now. And now the books that we come, and everything has a genetic basis now. Things are changing, and they are changing really fast. And I think it's only right that the potential, the minds that we have in India, we change along with it, along with time, both in the direction of research and in the direction of prevention and therapeutics. So I think those were just a few thoughts that would come to my mind. Ma'am has so beautifully touched the intricate points of how do we establish a camp, because those are the practical points of it. I have learned a lot. I hope that somehow I can contribute in some way along with my college heads in this city of Amritsar, because I think that's the most beautiful thing about AMSA. One person can spread knowledge to all of India, and as much I hope that all the college heads could absorb a lot from here. So at the end, thank you once again, Shravya, for doing an amazing job. Thank you once again, Asmita, for giving us this opportunity. You have been amazing throughout, and thank you so much, Dr. Chetna, for every word that you have said.
Thank you.
Thank you so much, Avi. Thank you so much for your valuable inputs on this vast topic. It was a nice compliment to ma'am's huge presentation. So right now, guys, we'll be displaying a QR code on the screen, which is the post-event questionnaire. So do fill that out, because that has all the general details and also a small tiny quiz at the end of it. And that will lead you to the certificate process, right? So just scan the QR code on your screen. We'll also, for the ones on the WhatsApp group, we will put up the link on the WhatsApp group so you guys can directly click the link. So until you guys do that, I will take this time to again give a vote of thanks to Dr. Chetna, because we have organized camps. I was a college head too, and we have done lots of camps, and we always forgot the tiniest details. Like if we got the water cans, we forgot the water dispenser, or very small, minute details. And it takes micro planning to pull off a successful camp. And I'm sure to all the college heads that are here, you got a brief and a very clear idea about what to look out for and whom to go about and ask permission and conduct a successful camp. And like they say, prevention is always better than cure. So we can do the groundwork and help a lot of people screen it in the earlier stages, and we'll be giving back to the society a lot. So thank you, ma'am, again, for taking time out in your busy schedule to help us out and guide all of our college heads. And a thank you to Ashmita. She is the Secretary of Newsletter for AMSA India. And without her, this program would have not been possible. She contacted ma'am. She made sure this event was a success. So thank you so much, Ashmita. And thank you to AMSA India for giving us this wonderful platform where all the interested college heads could come and learn something which they are really passionate about. So thank you everyone for giving us your valuable time. To the people who have already screened and filled the post-event form, your certificate process will be complete. To the ones who are yet to do it, we'll also be putting it up on WhatsApp in case you can't scan this QR code. So that's all from my side. I'll hand it over to Ashwata now.
Ma'am, thank you so much for coming in the last minute for this whole thing. I know it's been a really hectic day for you. Ma'am just conducted a camp in the morning for all of you who don't know. And like she just drove home and is now here conducting this for you guys. So I hope you guys can take something back from this. And like, it's not compulsory to have a camp, but like, as you see, it's kind of fun. It might seem like a headache a little, but with all the planning and everything, but in the end, after all the effort that's put into it, I'm sure it feels like an amazing success. So I hope you guys take something back from it, even if it's not a cancer screening camp, like some camp, like a diabetic screening camp or anything for that matter. Go ahead, try your own camps, get permission from your college and all the other like respective people like the panchayat and stuff, and try your best to execute this. And I hope you guys really do this because it's a really great thing to do. And yeah, so I shall end this session right now. Thank you guys, and thank you everyone.